In this video, we will walk through how to add an elective TCI card clinical note to a patient's record in CareFlow. An elective TCI card is completed and submitted when you need to advise the elective admissions department that a patient requires hospital admission for surgery or treatments that can be scheduled in advance. For this walkthrough, it is assumed that you have added the elective TCI card clinical note template to your favorites in CareFlow, and you know the various means to create a new blank clinical note, ready for editing. For this demonstration, we are creating a TCI card for a patient following their appointment in an outpatient clinic. So we must first locate the patient's appointment in the patient reception screen of CareFlow from the list of appointments in the clinic on the date the patient was seen. Right-click on the patient's appointment and select Add Clinical Note. Select the TCI card clinical note from the list of your favorite clinical notes. Then select the Next button to create a new TCI card associated with the patient's appointment. The elective TCI card consists of 2 pages, one for the clinician to record procedure details and the other for elective admissions to record that the patient has been added to a waiting list. Pages marked with a red asterisk have mandatory fields that must be completed before the clinical note can be saved as completed. Mandatory fields on the page are also marked with a red asterisk to assist in identification. Fields that are pre-filled with content in blue italics require the user to confirm that the content has been seen and is correct. Check the content and confirm it is correct by placing the cursor at the end of the text and pressing Enter. This turns the text black. Alternatively, you can edit or replace the entry as appropriate. Selecting ophthalmology or orthopedics as the specialty performing the procedures will create an additional page with questions relevant to the selected specialty. Click the new page to view and enter details there. Select Other to dismiss the extra page. Section 1 of the elective TCI card prompts you for details of the patient's consultant and the medical terms, or national codes, for the procedures to be performed on the patient. To add a procedure, click New. In the Procedures field, enter the medical term or national code for the procedure. Then click the search icon. If the procedure is recognized, the word Procedures will appear. Click the arrow to drill down and provide additional information. Once satisfied, click outside of the Procedures box. This will populate the code and description fields. Other fields about this procedure are either read-only or optional. Optional fields should be completed as appropriate. The date field is mandatory, and should reflect the date that the TCI card was created, or most recently edited. Click Add to add the procedure to the Procedures table. Add additional procedures as necessary, with the New button. If you are familiar with the national codes for a procedure, you can directly enter these in the Procedures field. Don't forget to precede the first code with a \. Click the magnifying glass icon to display and check the medical terms associated with your entered codes, then click outside of the Procedures box for other fields to be populated. Click Add to add the procedure to the Procedures table. To update a procedure, select it, make your changes, then click Update. To delete a procedure, select it to open it, then click Delete. You must confirm the deletion. If a procedure you enter is not recognized by the national coder, manually enter its details in the field called Planned Procedure, free text. After entering the procedures to be performed on the patient, complete the further sections of the elective TCI card ensuring that all mandatory fields are completed. To speed completion, some fields of the elective TCI card are pre-populated with common default values. But you must ensure that the entries are appropriate for the patient's surgery, and adjust if not. The TCI card will become quicker to complete as you become more familiar with it. If the red asterisk remains present on the left of the screen against the page name, there are still mandatory fields that need completion. Mandatory fields are indicated with a red asterisk. The Complete button becomes enabled once all mandatory fields are filled in. You can now either save or complete the TCI card. Save will save the TCI card without submitting it to the booking team. Use this option if you are leaving the form in a partially finalized state for later completion. Complete will save your patient's TCI card details and submit the information to the theatre booking team. Selecting this option will send the TCI card details to the elective admissions booking team for further processing and addition of the patient to an appropriate waiting list for elective surgery. After you save or complete, you are returned to the previous screen. To view a TCI card you created for a patient, visit the patient's homepage and view their clinical notes. The status will state whether you are viewing a draft or completed TCI card. Click on the arrow alongside the TCI card to open a dialog from which you can either edit or view the clinical note. You can also view or edit the note after opening clinical notes in full screen mode. For example, after selecting View Clinical Notes on the green menu. Or you can click the View All button on the Clinical Notes widget. In either case, select the eye icon alongside the note of interest to open the dialog that permits you to edit or view the note. Should you edit a TCI card that you had previously saved as completed, you must email the elective admissions booking clerk to advise them that the patient's submitted TCI card has been updated.